I don't believe that the amount of money put into the clinic services adequately represented the financial burden on taxpayers.
In her 32 years in nursing, the last 15 as a nurse practitioner, Sue Bornemann says she's never had an experience like working at Newcap.
Newcap is inefficient. They lack an understanding of continuing education, very dirty, unprofessional, a general lack of caring for the clientele.
The clinics provide access in healthcare to patients who otherwise don't have it. They don't have insurance at all, or they have very, very poor coverage. Many don't speak English.
Dr. Herb Coussons has been Newcap's medical director for the past 10 years. He says it's largely an advisory role, but he provides on-site training for the personnel that works in Newcap's clinics. He disagrees with Bornemann about the quality of care provided, pointing out the clinics recently passed state compliance checks.
And I personally have trained the current nurse practitioner, so I know what her skills are and that she's a good provider.
In its 10-county service area, Newcap has 6 health clinics. On its website, the locations in Green Bay, Shawano, and Marinette are listed as being open 5 days a week, Eagle River 2 days a week, and Oconto and Crandon by appointment only. According to tax documents, Newcap's community health services include low-cost and no-cost health coverage options, family practice and basic chronic health care for those ages 1 to adult, as well as reproductive services for males and females. Overall, Newcap received $13.9 million in government money in 2024 to provide its services. Specifically for community health services, Newcap spent $2.9 million in 2024, according to tax documents.
Considering the amount of money that they get, taxpayer money, millions each year, what do you think needs to happen with Newcap?
I believe that Newcap needs to have a deep audit. Are we even seeing any benefit out of the small number of services that are even being provided to the people who actually go there and stay there for care? Are we seeing any decline in pregnancies, any decline in STD acquisition and spread?
Bornemann says one of the first things that surprised her in her 7 months working at Newcap was the amount of people she treated each day.
We wouldn't see very many patients. Maybe 4 or 5 were on my schedule in a day. I was told that if I don't have people on my schedule at the end of the day, I could just leave. I didn't find that that was the appropriate thing to do, being that it's a walk-in clinic.
You said that it was a walk-in clinic, but you wouldn't get many people. Why do you think that was?
Advertising. We did not have any advertising going out that I personally saw. I really don't know how some people could have even found us.
Less than a week after Fox 11 Investigates started reporting on concerns about Newcap, the agency's executive board put CEO Cheryl Dietrich on administrative leave for the, quote, foreseeable future.
Weeks before she was put on leave, we wanted to ask Dietrich about some of the concerns Bornemann and others were raising. She wouldn't do an on-camera interview, but was willing to answer our questions over email.
On the number of patients treated at the clinics, Dietrich told us Newcap clinics are not urgent care facilities, so services are generally scheduled rather than walk-in. Some locations serve very small or rural communities, some are used periodically to meet specific needs, and others are newer sites that are still building utilization in coordination with community partners and funders. We also asked Dietrich how much Newcap advertises its services. She told us that's limited and focused on informing communities about available services. Activities include both program-specific outreach governed by grant requirements and modest agency-wide marketing supported through administrative budget and procurement policies.
Making people in the community aware that these services are available has just not been a focus.
At the northern clinics, like in Marinette, Bornemann tells us only 1 or 2 clients are usually seen each day, leaving workers with little to do.
I was told that they would often do work for their other employers while they were working at Newcap.
For the medical clinic in Oconto, multiple former Newcap employees who had non-healthcare jobs in the same building said they rarely, if ever, saw anyone there for services. One former employee told us when she left last year, it had been at least 5 years since she saw anyone there for treatment. A common story former employees shared with us was one time a Newcap employee from Green Bay went to the Oconto clinic to make it look like patients were being treated there.
When this person was asked what they were doing, she said, I have to stage this because we're going to be inspected and we bill people coming into Oconto. And when they were asked, said, there's no patients in Oconto, and she said, well, we got to stage it.
When we asked Dietrich about the Oconto site, she told us there were 82 completed appointments in 2022, 72 the next year, then 27, and 33 last year. That averages out to fewer than 3 residents treated per month. She says while the clinic has not had full-time staff in recent years, patients have continued to be seen there when appointments are scheduled. Documentation of services is maintained in Newcap's electronic medical record system.
There are patients being seen there. You know, I specifically called the current nurse practitioner and nurse and said, how often do you go? How many do you see? And I trust them when they say we go 1 to 2 days a month and we see 1 to 2 patients each day.
Why would you keep that open if there's only 1 to 2 a month potentially, and you got a clinic in Marinette, you got a clinic here in Green Bay?
I question the same thing, right? So some of those people have transportation problems.
Coussons tells us his role doesn't come with any access to how Newcap is spending its money for medical services. He says he's asked without sufficient answers, especially when provider positions haven't been filled when someone has left.
What's happening with the funding? Why can't we pay to have more nurse practitioners? Because the need is there.
I personally think that a deep audit would be beneficial to assure that the amount of money going into Newcap is being adequately utilized to serve the most patients possible.
Of the millions of dollars in government money Newcap receives each year, the 6 former employees we initially spoke with shared a concern that money is often shifted from its intended use. Since our stories on Newcap started to air, other former employees and current ones have been messaging us with the same concerns. That's the focus of our next story on how Newcap is using taxpayer money. For Fox 11 Investigates, I'm Ben Krumholz.